A few weeks ago, we introduced you to PA Green Wellness. Today, we're discussing how they aid in the treatment of pain and injury, surgical recovery, and the potential to prolong a healthy and vibrant life. Director of Patient Services at PA Green Wellness, Jen Fry, joins us back on Good Day PA. Welcome, Jen.
Thanks.
You bet. Let's just start, and we're going to talk about human cell tissue product, or HCTP. What do you think everyone needs to know, and what are they a little worried about?
Human cell and tissue product is regenerative medicine. So the introduction of this into the body tissues is literally changing the body tissues. It's biologic tissue change. And this means we are not covering symptoms. This is not a pill, this is not medication. This is actual body transformation.
So we can clear up these misconceptions. How important is your lab in this process and the source of the human cell tissue?
So great question, because the lab is enormously important. We only use Predictive Biotech. Not only are they an FDA approved lab, but they're the only lab that has a patent to extract mesenchymal stem cells from the umbilical cord tissue. These are the most vibrant stem cells. They're signaling very strong. And this also means every injection that comes out of this lab, and we're talking about over 100,000 to date, is consistent, clean, high quality. We are not extracting stem cells from your body fat and re-injecting these old, tired stem cells, selling them back to the patient. We don't do that. We only use very high quality product from Predictive Biotech.
These cells are only days old?
Yes, they're less than a day old, in fact.
Wow, would you help us with this? Give us an overview, what we can learn, because I'm sure this is one of the things that you consult with the professionals at PA Green Wellness.
Yes, we as an early adopter of this treatment, especially in this area, we have a responsibility to educate the public. There are misconceptions about stem cells. Not all stem cells are the same. Mesenchymal stem cells from Morton's jelly is the highest quality. Patients come in, they meet with an MD. We are an MD-driven practice, and our MD is at our monthly seminars. We do free monthly seminars for education around this.
And where are these seminars?
We have seminars in Lewis, Delaware, Philadelphia, Harrisburg, and all the way out in Erie.
Okay, and what would you recommend to people who do go to these seminars and want to get the most benefit out of their experience with PA Green Wellness?
So we like to see patients get the most out of their injection. Following injection, there are several months of high signaling time. We like to introduce EPAT therapy, which is also acoustic pressure wave therapy. We find that it has an amplifying effect on the treatment, and we help the patients to achieve the most out of it. This 4, 5, 6 month window of high signaling time is the time to make personal changes. It's a great time to quit smoking. Everything is easier. Adopt a fitness program.
Very good. One of those things that we want to say that this is not like two stem cells are ever alike. And before we wrap up and go to the EPAT that you were talking about, which is fascinating, what would you say the first thing you would say to people to get over their fear?
So the fact that we use Predictive Biotech is an enormous qualifier. Not only are we MD driven, but the lab itself is highly controlled, the procedure is controlled, and we are certified.
Absolutely, and that really makes me feel better if I were to talk with an MD and find this out at your free seminars, which are on your website.
Sure, the list of conditions that this treatment helps is enormous. Anything regenerative is going to respond.
Absolutely. Well, thank you so very much for clearing that up. I know we're going to see some vials in the next segment.
Yes.
And it looks a little more up close and personal.
It's always a pleasure, Sunny.
My pleasure. Thank you. As Jen just shared, there are so many benefits to regenerative treatments, including an emerging treatment called EPAT. Now let's take a look inside the PA Green Wellness exam room and see an EPAT treatment in action. Extracorporeal pulse activation technology, also known as EPAT, is a non-invasive, non-surgical treatment designed to help patients who are suffering with both acute and chronic musculoskeletal conditions or injuries. It involves shock waves to reduce pain from inflammation. Here's what you may expect to experience in a treatment.
So what I do is I make sure the patient's comfortable. We then find the localized pain points on the body. We'll mark that spot. Then we apply the coupling gel. Once the coupling gel is applied, then we apply the transmitter to the painful spot on the body. The transmitter will then break down any scar tissue, inflammation. It's going to create blood flow to the inflammation, grow new blood vessels, which hence creates less inflammation in the body and no pain.
Although EPAT is an emerging treatment for pain reduction, Dawn shares some of her list of contraindications, which are specific situations or conditions that determine when a potential patient is not a good fit.
You want to make sure that you don't have any hemophilia, cancer, pregnancy, thrombosis, DVT. You also want to make sure that you don't have any cortisone injection 4 to 6 weeks prior to your first EPAT treatment.
For patients who qualify, PA Green Wellness provides a special offer, which Dawn explains.
Here at PA Green Wellness, we offer acoustic pressure wave therapy as a bonus to your human cell and tissue product injection. We find that it amplifies your treatment.
PA Green Wellness welcomes new patients who want to know more about the benefits of regenerative treatments. For more information about PA Green Wellness, please visit pagreenwellness.com or call 1-888-338-6001. Their Harrisburg address is listed on your screen. More Good Day PA is just ahead. Stay with us. We'll be right back.